This is Kada. She's 15 years old. She needs a wheelchair to get around because she suffers from spina bifida. For the last 6 months she has been a patient at the University of Cologne Hospital. This is 9-year-old Jasmine. She has suffered from brittle bone disease since she was born. Till now she hasn't learned to walk. Getting back on your feet, that is the aim.
Hoch. Und feste, feste bis unten. Gut. Und nochmal.
The Cologne concept for the treatment of bone and muscle disease was developed in the pediatric department of the University of Cologne Hospital. Till now, muscle and bone diseases were treated individually. Our concept is original in that both diseases are diagnosed and treated as an entity. Various medical establishments have cooperated during the development of these new diagnostic procedures for the analysis of muscle and bone development initiated by the Cologne concept. During the examination of the bones, their structure is made visible and the density of the bones is established. The arm is presented as a cross-section in layers. The grey areas inside both of these bones displayed here are bone defects. A healthy bone looks totally different. It is a lot denser, which can be recognized by the red colouring. The principle of bone development diagrammatically represented. Different sorts of cells work together. Red, the bone-degrading osteoclasts. Yellow, the bone-building osteoblasts. The process is regulated by the strength of the muscles which mould the shape of the bones. No stable bones can be formed without sufficient movement. The more active or sporty a person is, the more muscles stimulate bone growth. Osteoblasts add external matter so that the diameter of the bone increases and therefore becomes thicker and stronger. The so-called DEXA bone density exam analyzes the composition of the body consisting of bone, muscle and fat. The precise measurements of these parameters is crucially decisive in the therapeutic effect and success of the Cologne concept. An especially important part of the diagnosis is the exact determination of the functions of the muscles, their strength and performance. The Leonardo force platform is used for this. The measurement shows how much leg strength Kada can already develop when she tries to stand. This will be checked regularly in the course of the therapy. The concept of functional muscle-bone unity developed by the Cologne work group has a special significance for those who have to use wheelchairs. When it comes down to it, we have to deal with two illnesses. The original or first illness that results in someone having to use a wheelchair. And then comes the second illness on top of that, which results from inactivity. That means the system isn't being used. As a consequence, we have to treat both illnesses. The basic principles to help patients like Kada came from space research. Expeditions into space have consequences for health. The astronauts move effortlessly because there is no gravity, but when no effort is used, the stimulation for the bone structure is missing. As a consequence, similar to wheelchair users, they suffer from muscle weakness and bone abnormalities. The reason is that due to the lack of movement, the muscles begin to atrophy and the bones are not used enough. And this sends a signal to the osteoclasts to remove bone material. It will be taken away from inside. This cooperation between muscle and bone makes biological sense. For this reason, we also speak of a functional unit. In nature, this means that in the body's biology, the functions that are used are built up, are strengthened. The functions that are not used are again metabolized, because actually they're not necessary. In the future, this will be prevented thanks to special training methods. The Center for Bone and Muscle Research of the Berlin Charité has found the Galileo system particularly effective for this. Basically, this consists of a vibrating plate. The company Novotech developed this instrument. It is also used here on Earth and is central to the new Cologne prevention and rehabilitation concept. The speedy whipping movements of the plate are particularly important. These activate the muscles. The effect can be observed not only in the legs but also in the trunk. This is extremely important for neuromuscular illnesses. The exciting thing about this therapy is that it involves automatic muscle spasms which are produced by this plate. This means that even when the patient has, for instance, nerve disorders and is not able to move his or her own muscles voluntarily, the movement of this plate stimulates contractions in the muscles. These graphics show in a simple way how these automatic muscle spasms happen. The whipping activates the so-called spindles in the muscles and tendons. The spinal cord is informed about the change of body position by the nerves. The spinal cord activates and coordinates the muscles for balancing movements. The muscle contracts. This is repeated many times and results in the buildup of muscle. Jasmine is at home. After learning how to work with the Galileo system in the hospital, she has been training with it for the last 6 months in her own room. She began in this position at an angle of 10 degrees and has now already progressed to 45 degrees. She exercises on the Galileo twice a day. It is a crucial pre-requirement that one can train using this method over a long period of time, and it is also an important basic part of our future rehab measures that the patient, in the course of the clinical treatment, learns how to work with this system, and then continues with the therapy using the same system at home.
So, jetzt stelle ich an.
Kader still trains at the hospital under the supervision of physiotherapist Ingrid Dammertz.
Das will ich sehen. Nochmal. Ja, das ist gut. Okay, halten, nicht zurücksacken. Bleib so. Du merkst richtig deinen Ruck hier, ne? So, okay, gut.
She has made significant progress since beginning 3 months ago.
Indeed, most importantly, here when bending the knee, a lot has changed, and also, of course, the strength of the legs. At the beginning I thought I'll never manage it, but then I saw my knees getting straighter and my muscles getting stronger. You have already achieved a great deal. The dilation here is of course important to be able to stand and at all for walking naturally.
The patients get further supervision at the orthopedic hospital and in the Medifit Rea Center. An individual training program is especially developed for each patient. Physiotherapists and graduates in sports science accompany the training. These additional therapies result in a variety of differing stimulations to the bone structure and musculature in order to achieve an improvement in function. Obviously, the children enjoy the therapy, which contributes markedly to its success.
I remember the first time that you came here, we did this exercise with the very, very small bags, but they were so heavy you could hardly pick them up with your hand.
The quality of Jasmine's life has really improved with her increased mobility.
I can sit, I can already crawl with my head up, and I can also sit for longer.
Ich kann jetzt auch länger sitzen.
Prima. Siehst du, Hast ja geschafft.
But that's not yet all, for her aim is
I'd love to be able to stand and walk.
we can't promise all wheelchair-bound patients that come to us to perform a miracle so that they can stand and walk. What we can do is, using this new diagnostic system and therapeutic method, we can reawaken muscle and body functions. Functions which, especially if one is in a wheelchair, would not be used anymore in daily life.
Ja.
Ja, siehst du.
In the meantime, Jasmine has discovered that she does have the muscles that enable her to stand on her feet.
Ja.
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 Und?
And walking begins with standing.
Prima, die Füße stehen auch gut, Jasmin. Gut. So, guck mal, beide Hände habe ich hier. Oh, beide Hände habe ich frei. Du stehst alleine. Köpfchen hoch, dann nehme ich dich. Okay, ich hab dich wieder. Ah. Gut gemacht.